Something amazing happens when you buckle a seatbelt. It's kind of magic when we put our phones out of reach, like in the glove compartment, or give extra room for someone on their bike. That little act of stopping to let someone cross the street, it's a thing of beauty. Even getting a ride home after drinking is quite heroic, because doing all the little things plays a huge role in keeping us safe on the road. Together, we get there. A message from the Washington Traffic Safety Commission.
We got the feeling now?
Yeah! R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on Rainier Avenue Radio .world.
Are you feeling the Seattle squeeze? The Seattle Department of Transportation has an app for that. Maps will let you find where construction is taking place now and in the months ahead, and you can even set up email notifications. Find more info on SDOT's blog or access .maps at streetwork.seattle.gov/map.
Mga kaibigan, ito po si Kuya Bert Kawili.
And this is Miles Salvador from Australia.
And I'm Norb Kawili, also known as Norbcam.
Kung gusto niyo po ang latest news and events from the Philippines at yung local Filipino community, Phil-Am Radio po.
We play Filipino music and interview guests from all around the world.
And I'll keep you updated on the latest Seahawks and sports news.
Kaya always tune in. Phil-Am Radio every Tuesday, 1 to 2:30 p.m. Pacific Time on Rainier Avenue Radio .world.
And in YouTube and Facebook. Salamat po.
The Waterfront Block Party 2022, hosted by Friends of the Waterfront Seattle, is coming up Saturday, July 9th at Pier 62 from 4 to 8 p.m. It's free and all ages. Celebrate the arrival of summer at Pier 62 with your waterfront neighbors, featuring free live music, dance, parades, food trucks, a beer garden, and more. Come on down to Pier 62 and celebrate the summer at the Waterfront Block Party, July 9th, with friends, family, and the community.
This is Paul Pearson, host of Star Time. And when I'm not using my GPS to navigate the land of 1,000 dances, I'm listening to Rainier Avenue Radio .world.
Welcome to Rainier Avenue Radio .world. It's me, Tony B. I am your host. For the impacts of the coronavirus on South Seattle and surrounding communities, show we've been doing every week since March 13th, 2020. And basically, the coronavirus has impacted everything. So this gives us an opportunity to talk to a number of different folks about what they do, how they are doing it, resources that are available to you in the community, and just continuing to establish connectedness and keep you informed. Well, what we're going to be talking about today is free healthcare. Yeah, that's right. I said free healthcare, and the fact that starting today, 4 million Washingtonians are going to qualify for free or discounted health care at hospitals across Washington. So you know how we get down. We're going to talk about it. We're going to share some information, hopefully shed some light, and maybe get some folks who currently don't have health care the path to finding free 99, if that actually exists, we'll find out, or discounted healthcare. Again, just lots been going on in the news, just in general, lately. Roe versus Wade, and all the different dominoes that has impacted. Wow. And well, what we're going to focus on today is something that seems a little more hopeful, which is free healthcare. At least that's what I'm told. And so we're going to find out exactly, what the case is. Joining me on the program, Assistant Attorney Audrey Udashen. Audrey, Assistant Attorney General Audrey Udashen. I'm saying that. Audrey, welcome to the program.
Hi, Tony. How are you?
Well, under the circumstances, I'm fantastic. How are you doing?
Good. I'm excited to be with you because I live in the neighborhood and I listen to Rainier Radio. So I was excited to get to talk about this new charity care law that the legislature passed.
Well, that is awesome to hear on both accounts. If you live in this neighborhood, which you say you do, then you know that we have an amazing neighborhood where people do incredible things every single day, members of our community. And of course, that's what we like to share. And so I got to give you a big shout out. The Assistant Attorney General lives in the 206 in South Seattle. Everybody lives in South Seattle. Well, thank you, Audrey. And how long have you lived in this community? Now I'm getting in your Kool-Aid a little bit.
No, you're good. Since 2012? 2012?
Okay.
For a while.
Yeah. So
Yeah.
you've been here for a minute.
Yeah.
Yeah. Maybe not 10 minutes, but you've been here for a minute.
Yeah.
How do you like the neighborhood, or do you like the neighborhood?
I love it. It's great. It's such a great mix of different things and great food, and the lake is beautiful and great neighbors. My family's lived sort of all over South Seattle, and we've really enjoyed it.
All right. Well, then again that we are now located in the historic Columbia City Theater.
Yeah.
And broadcasting here, and we're open for business now, but we'll be making sure that we provide a safe place for members of our community to partake in, to participate in, to create arts of all kind. That's a PSA I just did. Self-promotion. Anyway, back to the topic of this. This is very hopeful for me.
It is.
Audrey. There I mentioned there are so many things going on right now in the world.
Yeah. Yeah. Well, let me tell you about it and make you even more hopeful. How's that sound?
Say it again.
Let me tell you a little bit about it and make you even more hopeful.
I'm going to get to that. I know I'm positive.
Sorry to rush you.
No, that's okay. We can get revved up and get going here. I did want to talk about a little bit about you. You served as Assistant Attorney General in the Consumer Protection Division of the Washington State Attorney General's Office since 2015. You lead the Consumer Protection Division Healthcare Practice, and you joined the Washington Attorney General's Office in 2015 after working as a civil legal aid attorney representing homeowners in foreclosure and public defenders. Why do you do the work that you do, Audrey?
Yeah, I do it because I feel like the law can be a powerful tool when used in the right way, right? And I was lucky to have access to a legal education, and I'm trying to use that privilege I have to get a legal education to help people, get greater access to whether it's, legal services or over my work for the last 7 years, access to free and reduced cost medical care. So it's just my way of trying to give back and be a good community member.
Okay. Well, here we go. If you listen, you know how I get down. I have open, honest, frank conversation. Free healthcare. I want to talk about that, what it means. And I'm sure, as you know, or you should know, that when you say government and you say free, people think that right away, okay, there's some hoops I'm going to have to jump through because of this. What's the catch? If the government is providing it, it's not going to be the quality of care
right
I would ordinarily get. Now, those are just three things that I brought up. I know you wanted to get into this, but I need to make sure that the people who are listening to this right now, who in some instances are probably folks on the fringes if they don't have healthcare care, and there may be reasons for that. I want to start by addressing those particular issues, and I don't know how you want to start doing that. But when you come out and you say, as of today, 4 million folks might be eligible, maybe a key word, they're eligible for free or reduced price health care. How does that work?
Yeah. So the way it works is that actually, since the late 80s, hospitals in Washington state have been required to provide free and reduced cost healthcare to low-income consumers.
Mhm.
So what that means is the hospitals are actually required to write off charges to patients if they're low income. What's happened today is that the pool of people that qualify based on their income has expanded, has moved a little bit up the income ladder to where it used to be you had to make below 200% of the federal poverty guidelines. Now it's been moved up to include consumers a little higher up, people who are still struggling, up to 400% of the poverty guidelines.
Mm.
And so it's healthcare that you would receive at a hospital, and it's just that the hospital can't bill you or charge you for that care if you can demonstrate that you're low income to them. So it's the same healthcare that everyone receives at hospitals. It's not provided by the government. Is that the hospitals are required to give discounts to low-income folks.
Now, is this any hospital? Is it certain hospitals? Is it private care? How does this work? Where can you get the care that you're looking for health-wise?
Yeah, so it's any hospital. So that would include, but it's only hospitals, right? So it's not like dentist offices or optometrists or small clinics. It's just the hospital. So be thinking about Swedish or Virginia Mason, Harborview, Valley Medical Center. That's where the charity care requirements apply. And that's because historically and currently, those entities are nonprofit entities, so they don't have to pay the same taxes as other businesses. So they have some extra obligations to give back by giving discounts and free care to their low-income patients.
Now, is this just emergency care when you go into the emergency room? Is that what we're talking about? Or can you make an appointment and say, I would like to see a physician and get ahead of this? Because that's what you always tell us that we should do. Maybe not you personally, but health says, be preemptive about your health care, be proactive about your health care. But for a lot of folks, it results in them only going to get care in the emergency room.
Right, exactly. And that's such an important question. So this applies to all medically necessary health care that you receive at a hospital. So it's much broader than the emergency room. It doesn't include maybe some cosmetic procedures that aren't really necessary. But I would really encourage people to call hospitals, and when they're scheduling for care, say, I would like to understand more about your charity care or financial assistance program. Can you give me an application? Can you explain how it works? And like you're saying, be proactive about it and let them know and advocate for yourself and say, I understand this is my right to learn more about your charity care program. Please help me.
Okay. And how do you apply? How does one apply for this?
Yeah, so the hospitals have an application. It's supposed to be a very, very easy to complete application where you provide some information about your household, how many people live in your household, what your income is, and provide some very limited evidence of your income, like a pay stub or, your tax returns or something like that. And then the hospitals review the application and then just decide if you qualify. But one thing I do want to point out is that hospitals are required by law to be telling patients about charity care, helping them figure out if they qualify for it. And hospitals don't necessarily always do as good a job at that as they should. And that's what a lot of my work is around. And I just really encourage consumers to ask about charity care. But if they're not getting enough information from hospitals, to consider filing a complaint with the Attorney General's office.
Okay. I'm going to get in the weeds a little bit. I don't want to get too wonky, and I don't want to start using a whole bunch of $25 words.
Okay.
But I do want to bring people into this conversation so that they can comfortably listen.
Yeah.
What are charity care laws? What does that mean? What is that?
Yeah, and that's a technical term that I probably need to explain a little more. What it is it's the laws that require hospitals to make free and reduced cost care available to low-income consumers. So they're referred sometimes to as charity care laws or financial assistance laws.
And connect this to this thing called House Bill 1616. And what House Bill 1616 is, what it does, how it came about, and how it got us to where we are now.
Yeah, so what House Bill 1616 did is it built upon the financial assistance laws that already existed to raise income eligibility for charity care or financial assistance, because it was capped at very low levels, and there were still lots of patients out there who really needed some help, with their hospital bills, who didn't qualify. So all it did is take the hospital's, pre-existing obligations and say, actually, you need to offer charity care to consumers who are higher up the income levels. So to give you just an example, now for a family of four, you can, as that family of four, make up to about $100,000 a year combined with everyone's income and still qualify for some discounts on your hospital care. So that's what it did, is just moved income eligibility up.
Okay. And how do you find out whether you qualify? That basically, if you're eligible, you said bring in a pay stub. Those are some things, but what can you do, or what can an individual do personally to find out if they are eligible for this, or your family, if you have children,
right,
who are underage, if your children are eligible? We'll start with that.
Yeah, no, it's a good question. So one thing to do is you can just look up what's called the federal poverty guidelines. And that's put out by the federal government every year to kind of mark different levels to say, this person's at 100% of the poverty guidelines. This person's at 200%. My office has a chart on its website, and then it might be helpful if I just give some general kind of parameters to think about it. So if you're a two-person household, and let's see, if you make up to about $80,000 a year, about $60,000 a year as a two-person household, you're likely qualified for charity care. As a four-person household, if you're making about $100,000 a year, you're likely qualified. I can look up for a single person. You may qualify.
A four-person household could be two partners and two children.
Exactly. Yeah.
One parent and three children.
Exactly. Yep.
And at $100,000, which ain't where most people are at right now.
Right.
You become eligible to some extent, maybe for a discount or possibly free for a discount.
And then if you're below that level, you qualify for even more, right? So that's kind of the upper level, and then anyone making, levels below that, they're going to qualify for greater discounts or just full write-offs.
Okay, but just to put that in context, I read something the other day that the average Black household of four makes $48,000 a year.
Yeah,
which means that's way below
exactly
that 100,000. The average white household of four makes $96,000 a year, which is still below
exactly
that $100,000 that we're talking about.
Right. So that means most people, at least half of Washingtonians, and most people walking into a hospital should be asking, hey, do you have financial assistance? Can you give me information about it? Mm-hmm. Because they could get some help with their hospital bill. And I do want to point out, it's not just if you don't have health insurance. Mm-hmm. Even if you have health insurance, but they still bill you a lot. If you have deductibles and co-pays and co-insurance, you can still get help with that as well. So most people, I really encourage you, when you're getting hospital care, if you get a bill that, seems like something is really going to burden you financially, call the hospital, ask them what they, what kind of programs they have, ask for a financial assistance application.
Mm-hmm. If you've done this already and you're going, oh my gosh, I'm just finding it, is it retroactive? If you've already, been swamped by hospital bills. You didn't know about this. The hospital didn't mention it to you.
Yeah.
Can you go
It
back
is.
and alleviate some of the burden?
You can. So if you have bills that have been sitting out there for a couple of years, you really can still call the hospital and say, I'd like a financial assistance application, even if those bills have been transferred even to a debt collector who's still calling you, you can still apply for financial assistance. So there's no time limit on it.
Listening to Rainier Avenue Radio .world. My guest is Assistant Attorney General Audrey Udashen. Did I say it correctly again?
You did.
Udashen.
Yeah.
Udashen. We're talking about free healthcare. Starting today, healthcare has been expanded. That should include about 4 million people. You should be able to get free or reduced price healthcare. And you just heard it's retroactive. So if you've got a couple years of bills out there, check it out and find out. So there's something also called a two-tier system, which I guess is related to whether it's free or whether it's discounted. Is that right?
That's right. So the bill has 2 different tiers for hospitals, and that's because for some rural and small independent hospitals, their obligation to provide write-offs is a little bit lower than the big hospital systems and hospital systems in big urban areas, because the rural and independent hospitals just have a little bit less financial wherewithal. But assuming most of your listeners are in Seattle, all the hospitals in Seattle, I believe, maybe except for 1 or 2 specialty hospitals, are going to be in tier 1.
Okay. And yeah, although we have listeners all over the state, all over the country, literally all over the world, everyone knows we hyper focus on South Seattle and our surrounding communities. But is this something that is available around the state?
It is.
Everywhere. It's not just Seattle.
Correct. Yeah, it's a Washington state law. So all the hospitals in Washington do have to provide financial assistance.
Okay, so this gives me a nice segue into the role of the Attorney General. And that I talked about the specific role that you play. Some people might be confused why the Attorney General is making this statement, is why this is coming from the Attorney General's office. Did somebody sue somebody? Is that how we got to where we are today? You tell me the role. Start off with this. What is the role of the Attorney General, Washington Attorney General?
Yeah, it's a really large role, and I'm scared I'm going to miss, some part of it. But one thing the Attorney General does is he or she enforces our state consumer protection laws, which is, he has a staff doing that. I'm one of the staff members doing that. And so we have, over the last 7 years, myself and other, certain of my colleagues have filed lawsuits against certain hospitals where we allege that those hospitals aren't making patients aware of the availability of charity care, aren't asking them the questions to determine if they qualify. So essentially aren't doing what they need to do to help patients access charity care. So that's one role the Attorney General plays. But the role he played in House Bill 1616 is because our office has worked so much on charity care laws. He went to the legislature and said, we have some changes we propose that you make to the charity care law, including, expanding eligibility for charity care. And the Attorney General's office also represents state agencies and does a lot of things like that. But sort of as it relates to consumers and many of your listeners, it's the office that sort of is the government agency protecting consumers' rights.
Okay. And tie that all in now to free healthcare. Why this announcement is coming from the Attorney General's office?
Yeah, we're announcing it because the legislation that just went into effect was sort of requested by our office. It was passed by the legislature. So the Attorney General's office doesn't pass legislation, but we requested it and sort of promoted it and worked on it with the legislators. And then we continue to work on access to charity care issues for consumers.
And how is this paid for?
Yeah.
The money's got to come from somewhere. or maybe it doesn't. I don't know. We hear there's no such thing as a free lunch, but I'm here on the air right now espousing free healthcare and telling them it's free. Fill out the application, free 99, free dollars, free, or discounted depending on your who's paying for this.
So it's a cost that the hospitals have to bear, right? So it's not paid for by the government. The hospitals are required to provide these write-offs to patients, and that's because most of them are nonprofit entities, and they get a tax break. And because they get these tax breaks, then they have to sort of, they have certain obligations to the community, including providing free and reduced cost healthcare.
Mm-hmm. Is this something unique to the state of Washington? Is it modeled after some sort of federal similar healthcare law? Expanding on that, was this created from the ground up, from the roots?
It is, a lot of states have some version of this law. It kind of depends. It's a little different in Oregon. It's a little different in California. It's a little different in Idaho. And Washington does have one of the strongest charity care laws in the state. And it's much stronger than, these type of protections that exist on the federal level.
You're listening to Rainier Avenue Radio.world. It's me, Tony B. If you are just tuning in and you said, hey, I heard this was on there. Yes, we're talking about free healthcare. Starts today, right?
Today, yeah.
Starts today, but is retroactive. So if you've been receiving healthcare and it's breaking you down, because health has to win. And so fighting that challenge of, well, do I do this? Do I do that? But then there's my health. At the end of the day, health has to win. And so you incur bills and you have to get it taken care of at the time because you're in pain or you have a chronic illness or an emergency happen. And then you get this bill. And so joining me is, again, Audrey Udashen.
You did it right. Yep, Udashen.
The Assistant Attorney General, who also happens to live in South Seattle, saying, "I'm here to validate that what Tony is saying is true. Yes, free healthcare. Over 4 million Washingtonians will begin. How long is this gonna last? Is this some political thing that, depending on who's in office, this can be?" Because we saw what just happened to something that was 50 years in the.
Yeah.
So how long is this going to last, Audrey? Is this going to be over at next year if things turn over in the?
No.
Okay.
No, this is a state law that is permanent, and this has been a right that consumers have had since the late 80s. It's just that it's gotten stronger and better, in the last couple of weeks. But this has been around for a long time. It's not going anywhere. It was passed by the state legislature. So no, this isn't time limited.
And we're almost out of time here. So I want to make sure, because I've been peppering you with questions, and I think you're already seasoned. You don't need any more. So tell me what you would like to share with everyone right now who's listening to this and saying, okay, I think I believe what I heard. What do you want to share right now with those who are listening, those who are watching and listening about this topic that we're talking about? And I'm going to say it again, and if I'm saying it incorrectly, because this is what it looked like to me: free healthcare or discounted healthcare, and the potential for your eligibility has increased. So more folks are eligible to receive this healthcare, and hospitals have to comply.
Exactly.
If you are eligible and you apply and you meet the qualifications.
Yep. What I would really like your listeners to hear is that they should feel empowered to ask questions about their bill. The bills they're receiving are money that's being asked from them from hospitals. Hospitals have legal obligations to give consumers this charity care. So it may be a little embarrassing or difficult to sort of ask a bunch of questions, from a hospital, but they're legally required to give you this information. They're legally required to give you this charity care if you qualify. So I really want to empower people to feel comfortable if someone's calling you from the billing office or from a debt collector to say, I might be qualified for charity care. Can I get some more information on it?
And should that be the front desk person at the hospital, first person you see? Or do you have to say request a particular? Do you have to call the accounting department or the billing department, or you can just ask anybody? First person you see at the hospital who's taking you in.
Yeah, I mean, the first person or the last person, right? Good people to talk about it with are people who are registering you. You know, the nurses and the medical staff are probably not going to be the right person to give you this information. It's going to be the people that work at the cashier's office, the people that are registering you. If you call customer service, they should know about it. When you're calling to schedule care, that's a good time to ask about it. Usually on bills you receive from the hospital, there should be information about charity care and a phone number to call. Those are the best ways to start asking for more information.
Okay. Got about a minute here. Anything else, Audrey, that you want to share beyond me continually saying, folks, if you don't have health care, there is an opportunity to get free health care. And what I'm trying to do here, Audrey, is make sure that I am consistent with our listeners in our community as they say, I don't believe it. It's going to come with there's a catch. What's the catch? What's the catch?
There's not a catch. There really isn't a catch. It's only limited to hospital care. So that's a little bit of a catch. It's not all healthcare, unfortunately. And you will have to, provide some pay stubs or some evidence to prove that you're low income. There's really not a catch, but, there's a history of hospitals making it a little hard for consumers to access it, right? And so I really encourage your members to sort of like persevere, right? If they're having difficulty, with one person at the hospital, ask to talk to that person's manager, right? If they're having difficulty, consider filing a complaint with the Attorney General because it can be a little difficult to access it sometimes.
Yes, that you have to advocate for your health care. I'm saying that. I don't know if I'm just saying if you're off the list, you have to advocate. So if you don't feel like you're getting the response you want from the hospital, maybe you even feel, like you're getting pushed aside, and
right,
you can file a complaint with the Attorney General's office. How do you do that?
You go to www.atg.wa.gov and there's a complaint form there. You can also just Google Washington Attorney General and it'll take you to the complaint form.
Well, in the current political climate that we have right now, I think this is hopeful information. So I appreciate you coming on, sharing this with us on the day that it happens. Audrey, just thank you for coming on, and we'll see how this flies. Now, if people start contacting me and saying, nope, it ain't working, I'm going to call you back.
Please do. Please do. I really do want to hear from you if people are still having trouble.
All right. Thank you for joining me, Audrey.
Bye.
That's it. That's all the time I have. It's me, Tony B. You've been listening to the impacts of the coronavirus on South Seattle and surrounding communities. You can continue to listen and hear more information on the coronavirus and how it's impacting our communities on all of our audio platforms. If you happen to be on Facebook or YouTube or Twitch or Twitter right now, just switch over to our audio formats. You can go to the website and just click listen, or you can always download our app and hear another 90 minutes on the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B, and on behalf of Rainier Avenue Radio, remember, whether you believe you can or whether you believe you cannot, you are probably right. I'm out. Peace.